In Norway, over the last month, in Norway, in particular, Norway, 30,000 people, I guess, to date have been vaccinated. 29 experienced adverse side effects, and 13, it is presumed at this point, fatal side effects. So the chief physician, Sigurd Hortemo, of the Norwegian Medicines Agency, Dr. Hortemo, said the agency listed fever and nausea as side effects, which may have led to the deaths of some frail patients. However, it should be noted that all fatalities occurred amongst patients who are 80 years and above. So it's this sort of linkage to the fever and nausea experienced via the vaccine that was administered. The VAERS, I guess they're called, Vaccine Adverse Event Reporting System, which is jointly run by the CDC, or the United States Center for Disease Control Prevention, and the United States Food and Drug Administration, is recording any potential adverse side effects. And the numbers that I have to date at the end of January, 32 cases of decreased platelet count, 14 cases of thrombocytopenia, and 11 cases of immune thrombocytopenia. And then there was that fairly, I guess, well-known case that happened in December with the presumed very healthy Dr. Gregory Michael, an obstetrician and gynecologist from Florida. He was only 56 years old. He received the vaccine on December 18 and then died 16 days later due to a brain hemorrhage after receiving the vaccine. And he developed acute immune thrombocytopenia, which I guess prevents blood from clotting properly. So, pardon me. And then I read that David Scott, the CEO of the Palm Beach Research Center, said that the vaccine has passed every milestone for safety, but long-term side effects of available COVID vaccines cannot yet be known. But in the short term, allergic reactions can be among the reported side effects, and that he recommends patients be very, very forthcoming with healthcare providers before taking any shot. So then when whoever it might be, Newsweek was one of them, reached out to Pfizer and Moderna, and they, released a statement due to some of the, and I'm sure this is what Councillor Starr was referring to, whatever, videos, news articles, and this kind of thing. Pfizer said that at this time, we have not been able to establish a causal association with our vaccine, which is normal because it's only really begun to be rolled out. And Moderna said continuously that they will be continuously monitoring the safety of Moderna COVID-19 vaccine using all sources of data, which again indicates, we're in these early days. But my question to you would be, are we ensuring that people with a history specifically of allergies are made aware of the potential adverse side effects that they could experience in relation to receiving a COVID-19 vaccine either through Pfizer or Moderna? And then subset to that, should we be informing such persons?
So through the chair, thank you, Councillor Kovac. And I do want to really stress that what you've described in terms of the numbers in respect of adverse events, et cetera, must be placed in the context that there have been almost 7 billion doses of vaccine delivered worldwide at this point in time. And having worked in vaccine safety, one of the most important things that is done is this reporting of adverse events following immunization. It is a surveillance system that is intended to pick up anything that could be related to the vaccine, but it does not mean that it is related to the vaccine. It is in the interest of keeping the public safe that any time an adverse event is reported, it is reported into something like VAERS, or in our case in Canada, we have the Canadian Adverse Event Following Immunization Surveillance System, CAFIS, and that basically is every single adverse event that occurs after a vaccine is reported, because we want to be able to investigate it for causality. We want to be able to figure out, did the vaccine cause this outcome? oftentimes when you actually review the causal assessment, there may be other plausible explanations for why the individual may have had a serious outcome or a fatal outcome following the vaccine that was not related to the vaccine itself. And having worked at the federal level in Public Health Agency of Canada with the vaccine safety section, it's very common that many of those serious cases would cross our desks, and we would assess everything and oftentimes discover that there is another medical explanation as to why that outcome was observed. That was not the vaccine. So all that to say, the situations that you have described are pieces that I'm sure are being investigated by the appropriate regulatory authorities in the interest of continuing to make sure that the vaccines are safe. And also the mild side effects that you've described in terms of the fever, the headache, the nausea, et cetera, are well described. Those are things that are advised by vaccinators through the pre-registration process. And it's well known that those are typical side effects of any vaccine because it really represents your immune system responding to the virus as opposed to actually having the disease in question, which is a bit of Russian roulette, as we know, in terms of a new disease, and we don't know how people are actually going to take it. So I think that additional context to the numbers and data that you've shared are important. And then in providing an answer to your question, I would highlight that we do, the Public Health Agency of Canada has made that recommendation that individuals with severe allergic reactions, they continue to, that is something that has been put out by the National Advisory Committee on Immunization as just for provider and awareness in the course of vaccination. And certainly in the course of our mass vaccination campaign, we will continue to stress that at this point in time while the initial findings in the United Kingdom continue to be assessed for causality. Thank you very much for the question.
And thank you very much for your answer and for your patience. Thank you.
Thank you. Councillor Demerla.
Hear me? Sorry.
Now I can. Go ahead.
Thank you, Chair. Good afternoon, Dr. Lowe. I know I'm going to preface my question by acknowledging that you did say that vaccine prioritization is a provincial jurisdiction, but I did promise a constituent of mine that I would advocate on his behalf. And I think he makes an interesting point. He says his partner is a frontline worker, and he was saying that it's not enough to vaccinate the frontline worker, but also the entire family because I guess the family is at risk as well because of the frontline worker. And I said, you make
Deepika, I'm not hearing you now. If you can hear me, try to spark it up again.
Sorry, did you get the last part, or would you like me to repeat
but
that?
we got that. What about the partners of healthcare workers? And you said they make a good point, and I think there's a question there that I can direct to Dr. Lowe right now. How about the partners for our frontline workers and their families? Dr. Lowe, would you have a comment on that? When questioned about what are we...
Yes, sorry, through the chair, I was just realizing I misspoke when I was looking at the graph. It's not 7 billion doses of vaccine that have been delivered. That's the denominator for the world population. But we're actually more at hundreds of millions of doses of vaccine that have been delivered at this point in time in the US and in Europe, et cetera. So I did want to clarify that for the record, because I was looking up that graph again and thinking that that number did not make sense to me. My apologies to Council. To Councillor Demerla's question through the chair, I wanted to highlight, certainly we know that there are a lot of people who are very deserving of the vaccine, frontline workers, many different classes, sectors, et cetera. At this point in time, just given the limited supply, we have been told, and I think it makes sense, that the vaccine is being prioritized to individuals who are most vulnerable for severe and mortal outcomes, and that really is our senior population, in particular our seniors in congregate settings, and then working our way down. Certainly our healthcare workers were also there, just given their proximity to individuals who they might be treating with COVID, I certainly imagine that a lot of these concerns will be resolved once the supply it starts to increase again, and so recognize this among many other competing requests for vaccine amongst our population, and know that our province is really trying to use data and evidence as to the most vulnerable in our community to start with them first.
And I just thank you for that, and I will convey that back. And I just wanted to say, Dr. Low, as well, that just thank you for all of your guidance. And I know that there's a lot of frustration around the small business and their ability to operate through these lockdowns. And I think that really our advocacy really should be directed at trying to get.
Councillor DeMerle, I've lost the last bit. And if anybody else, you may have your mic on, so only if I could have the speaker, please. Councillor DeMerle, if you can hear me, we lost the last little bit if you wanted to try again. Okay, I think she was in the process of thanking you for all your efforts, and so I'll carry on. If she wishes to come back on the list, she shall. Councillor Parrish.
Thank you, Dr. Lowe. We got our list of what's open, what's not open, and all the rules for going into gray. If that should happen after Family Day, I think the small stores, my interpretation is the small stores are going to be allowed to be open. It says big box and discount stores, 25% of room capacity, and you're deleting shelving and all that other stuff, which makes sense. And I hope it's going to be enforced. Then it has another bracket, another section that says all other retail, including hardware stores. So does that tell me small shops are going to be open and they're going to be at 25% capacity, not including offices and shelf space?
So through the chair to Councillor Parrish, for the anticipated date of February 22nd and the projections that we will likely be entering gray lockdown, then yes, the provisions you've described would apply should it come into effect on that date.
Good, and I hope it does come into effect. I just saw today's numbers. We're at 88 in Mississauga, and we're at 0.43, and I thought it was 0.40 consistently that we needed to be at, so it looks like we're getting there. I noticed that left out barbers, hairdressers, and restaurants. I have to inform you, I will be going to a dog groomer to get this haircut. Dog groomers are working, and hairdressers and barbers are not. So hopefully I can get a little Afghan cut with the long ears. I still don't understand why hairdressers aren't open, but I'm not going to argue because people other than myself are making these decisions. Second question is, are those home test kits as effective as when you go and get the thing stuck up your nose?
So through the chair to Councillor Parrish, in general, any rapid test kit is used more for screening purposes, and then if you come back positive, you would ideally want to get a PCR for confirmation, the nose test for confirmation.
Okay, so if you come back negative, you still could have it.
No, it's more if it's positive from screening, then if it's negative, you're negative, and then if it's positive, you should confirm it.
Okay, good. I was just curious because I thought the home test kits would be much simpler to have. And the other question is to the staff. Now that this gray area says that repairs inside homes are up and running again, can we get our basement renovation project back on schedule for those who want to provide inexpensive housing for people who need it? That's more to the chair and I guess to Commissioner Sheehy.
I'm sorry, Carol. I don't know if Commissioner Sheehy could add. I know they're not working as we speak. I'm not sure. I'm assuming that when the restrictions come off, because others have mentioned that one to me as well. When do we get those workers back to work? I don't know if Commissioner Sheehy had something more on that.
No, through the chair, and thank you for the question. We will certainly be monitoring the situation. Of course, it is our intent to implement this program to create basement apartments. We do want to move forward with it. We just want to make sure that we're doing so in a safe way. Thank you,
Okay, thank you. Thank you, and thank you, Dr. Lowe.
Thank you. And we've come back down to Mayor Crombie if she's had a chance to conclude her other meeting and she's back possibly. So Bonnie, one last shout out for you because you're still on my list. If not, that concludes all my speakers. Dr. Lowe, thank you very much. I have a motion from McFadden and Groves that we receive your presentation. Are there anybody or anyone in objection? Seeing none, thank you very much and carry on. Okay, this brings us to 8.2, 2021 Communications Update for COVID-19 and the Mass Vaccination Plan held by Councillor Pelleschi. Michael.
Thank you, Mr. Chair. So I read through the report. Really like some of the things that it's talking about. A couple of the questions that I had for financial implications: the 150,000 per month for up to 8 months. Was that that was costs associated with just that agency? That's the question that I had. There was no. Like that 150,000 doesn't take into account anything else and above that we're doing. Is that correct?
Catherine, Commissioner can perhaps Lockyer can answer that, please.
Thank you for the question, and through you, Mr. Chair. Yes, that is correct.
Okay. So I guess it's very similar to the motion that I put forward and then was deferred, specifically with as it relates to a lot of the outreach. What I did want to try and put an emphasis on with this communication is doing something a little bit differently, especially with the new variants that are coming out. I think changing of the message is kind of like, it's like a restart where, people seem to get a little bit complacent with the current messages that are going out. And I'm watching as my social media and the likes and the shares that I get when I get the message out, which is a very, very similar, I find, to the region's messages and the sharing of that. It's not like it was in the beginning. So that's why I was kind of asking for kind of like not really a restart, but a revamp, like doing something a little bit differently. Also that I had requested in my motion that the mayors with the region put together some town halls to try and, I know that currently I'm sure the mayors are doing that in the municipalities, but maybe if we can get all three of them together with Dr. Lowe and any relevant hospital staff that need to be on those. I think getting the message out to a broader group of people, I think is something that's good. Hopefully that they can organize that to be something of weekly or even maybe bi-weekly. And I think that now's the time to start doing that, especially since that we're going to be going into wave 3. And then the other question that I had is with social media influencers, I think can play a big part in this. And that's why I ask about the cost, because social media influencers obviously make their money off of, somebody that wants to spread their message to their huge following. I'd like that to be included in this. So I don't know what the total budget is for this communication plan, but if there needs to be some more allocated for influencers, I'd like to amend it to include that.
Yes, Catherine.
Thank you, and through you, Mr. Chair. That is exactly what we've done with this agency, Councillor Pelleschi. What we have done is augmenting what it is that we have been doing. Communications groups have been doing an excellent job, but no matter how many times you send out the message, there's always the possibility of people just hearing the same thing over again or feeling like you're hearing the same thing over again. So this is a bit of a fresh start with fresh eyes, taking a look at what we've been doing. It is going to be focusing on a few different tactics and some fresh messaging, not only about the vaccinations, but a bit of a reboot, as you might say, for the Core 4, and also dealing with self-isolation. One of the reasons for choosing the agency that we did is because they have several arms within the agency. One of those arms is a media division that is really focused on social media. and they will have a lot of buying power, and that's the social influencers that you're referring to. So we do have that covered within this agency procurement as well as in this hiring. It also has a very strong multilingual and multinational arm to this agency as well. So we did give that a lot of consideration. And we are doing a collaborative effort with our municipal partners. So this is something that we are working together on. And as for the costs are definitely COVID related, and we have provincial funding which is assisting with those costs. So this is not, cost is not a barrier in relation to these communication efforts. So as you have characterized, this is a reboot, refresh, fresh eyes, reaching as broad an audience as possible, using a variety of new tactics, including the social media push.
Okay,
I hope that
thank you.
addresses your question. Thanks.
And it does, and there's so many companies out there, and I'm sure that we've chosen the right one that works for us. I would ask that a discussion is had with them to be able to try and reach out to. There's a number of people, born and raised in the region of Peel, from tennis stars, soccer stars, actors, musicians, that we could be reaching out to drive home a message that is a region appeal message. And then hopefully, working with, and it does talk about working with the three lower tiers. What I'd like to see there, and this goes back to also a comment to the CAO, if there's anything that we can do at the municipal level to help, please include. I know that the discussions are happening. I really wanted to have that motion going forward to say we're really all in this together. We will all decide on what the go forward is. We don't want conflicting messages. We want to all be on the same page, and we want to be able to get that message out at that time when we're all going to do it at the kind of the same time. To try and reach as many people as we can. I think that it's really important that those discussions are not only ongoing, but the decision making is amongst all of the municipalities as well.
Thank you, and I can assure you that there are those ongoing discussions, and that they are at the table. We are working with the local municipalities hand in hand, because you're quite right. It's the target is to reach the most people possible and actually have an impact with the communications. So that is underway. So thank you very much.
Absolutely. Thank you, Mr. Chair. Happy to move.
Thank you. As moved by you, seconded by Councillor Starr, the report listed as 8.2. Here for information and the direction that you've provided. Any objections to that motion? Seeing none, that is carried. That brings me to item 11.2, asked to be held by Councillor Sato, the report of the Waste Management Strategic Advisory Committee meeting held on January 21, 2021. And if I may, Councillor Sato, you're up to ask any questions you may have. Norm Lee, any answers you may have. I have to step away just for a moment. I'll be coming right back, but as per the bylaw, please assume that electronically and virtually Mayor Crombie and or Councillor Dipika are virtually in the chair as I step out and come back in about 3 minutes. Please proceed, Councillor Sato.
Thank you, Mr. Chair. And I wonder if we could get more explanation from the item 6.1, the townhouse waste collection options that were discussed at the meeting. I have some real concerns over what I'm understanding by the report. The recommendation appears to be that the options be approved and presented to the boards of directors and property managers. Those of us that have had this issue and who raised the issue and asked regional council to put a hold on moving to the CART implementation in the townhouse complexes in our wards. What we heard from our residents, and I had several public meetings on it with several of the condominiums, and what I heard, and I think others heard from the residents was different than what the management said. and in many cases was different than what the small number of residents who sit on the board said. And I prefer to listen to the people who are actually going to have to find somewhere to store those carts. I did attend several locations, met with residents, looked at their garage. They're stuck in the middle of a row of townhouses, so telling them to put their carts in the backyard doesn't work unless they want to haul compost bins and garbage bins through their townhouse. They have absolutely nowhere to store them. And I think we need to look at the reality that it doesn't work for everyone. And, I couldn't suggest, I saw some really creative solutions for what they have now, and that's before they go to the full cart system. And, one senior resident, he said to me, like, I can't get my car in the garage if I have the bins in my garage, because it's a tiny little garage, and he can't shovel his driveway. So he hires someone to come and shovel his driveway. He said, if my car's in it, they can't shovel my driveway. And, so there are a lot of issues. And I know Councillor Mahoney had some concerns in his ward, Councillor Raz in her ward as well, and presumably others. So I'm confused as to, there's 4 options here. They're all cart-based. I think we found out cart-based will not work in all of the condominium corporations, and we should not be forcing it on people when they have nowhere to put it. The consultation and the recommendation that it be dealt with the board of directors and the management is totally unacceptable. I think we told staff this it was over a year ago now. It was probably 2 years ago now. I think we were very clear that we said you need to talk to the residents, not the board, not the management. And in many cases, the management didn't even pass on the letters to the residents that the region sent out. So I'm not happy with what I'm reading in the report. I can't support it. I think this is a big enough issue. Mr. Chair is not there. Whoever's in the chair. I think this is a critical enough issue that should include a longer discussion, a more in-depth discussion with the councillors who have these issues in their wards. And I don't know if it's everyone or not. Rather than just at a meeting and then a recommendation coming forward. This is a huge issue for the residents that it impacts. And I'm very concerned over it. So I wanted to raise it today. I guess what I would like to see, I'd like this to be deferred. I don't feel I have enough information on it. And I would like to get that recommendation deferred until we can have a more in-depth discussion with all of us who, there may only be a handful of us that have the concern in our wards. So maybe we can set up a separate meeting with staff and go through that. And, I guess I'm feeling like the residents were not listened to when we brought this forward, when I think it was in particular Councillor Mahoney and Raz and myself, when we brought this forward 2 years ago. I just feel like this is exactly what was brought back before. It was almost like, oh, we'll wait you out for a year and we're going to bring back the same thing. And yes, there's some different sizes and things like that, but I'm sitting here trying to figure out what a 40-liter cart is, what a 240-liter cart is. I can't visualize it. And I'm not going to go on the internet and, start doing searches. So I'd like more information, but I would ask that this particular recommendation from the report be deferred until we can have a more in-depth discussion. Thank you.
Thank you. Can we just, Norm, I hear you, and I will table that in a moment, just to hear if Norm had a quick response, and then I can carry on with my list, knowing that the councillor would like it to go back. Norm, a quick response?
Certainly, and the direction we had earlier was to go away and come back to council with options, not to do any more consulting with residents or anybody like that until after we came back to council. So that's what we did. And you would see in the report the criteria that we considered Well, I'll start by saying, I mean, we did an environmental scan of other municipalities to see what they're doing with townhouses. And, that came up with the options that we have. We set some criteria that we think are important to look at, and council could have different views on that, but obviously to increase waste diversion and reduce contamination, reduce windblown litter that we've talked about before, preventing vectors and vermin, but what we really mean is rodents. And rodents and raccoons, and that's the challenge I think that we would face with allowing bags for garbage, and definitely for green bin type waste. Like I don't think I'm not aware of anybody who uses bags or allows bags for the food waste that goes in the green bin. So happy to have a discussion with these councillors if you want, and we can talk through some of these things. But each approach has its challenges. It's difficult to meet the needs of every resident while still keeping rodents under control and increasing diversion.
Thank you. Norm, within that, I apologize if I missed it, Councillor Sato, when I was out the room briefly. But if it were to go back 2 weeks, next committee meeting, does that cause us any grave hardship? We've got a couple of weeks more, 4 weeks more to try and defer this on. There's nothing imminent, is there?
From my perspective, no.
Okay.
With some of the COVID issues, we have to wait before we take our next steps anyway.
Okay, thank you. I'll carry on with my list then. Councillor Sato, I'll come back to you, and I know you've asked that it be deferred, but I do have Vicente and Mahoney that would like to speak to it as well. Councillor Vicente.
Thank you, Mr. Chair. And I'd like to support Councillor Sato's request for the deferral. Both Councillor Santos and I, and this is very timely, we had a discussion with residents in our ward who are vehement that we need to give them an option where they don't have to use the carts. The carts for them have been a problem, mainly around the idea of storage, but also property standards where you have residents who have really no option for storage and they're storing the carts on porches and on decks, etc., at the front end of the house. And staff from the region participated with us in these discussions, and we very much appreciate their support. And so we would like to encourage additional discussion. We'd like to look at options, not necessarily options from neighboring municipalities, but best practices perhaps from other countries or other places where we've seen that in very dense areas, there's perhaps a communal option, or if all else fails, and this is what the residents are demanding and asking for. Most residents are happy with their carts. There's no issue. But in these unique situations where they're asking to go back to the old way of doing things, which worked better for them, was easier for them to manage, perhaps that is the way to go. And so I don't want to forego any potential great idea or option, but both Councillor Santos and I would be very supportive of us continuing to find a better way to handle these very specific situations. We need bespoke solutions for some of these denser neighborhoods or townhouse complexes. Thank you.
Thank you, Melissa. Santos, Mahoney, Raz. Councillor Santos.
Thank you. And through you, Mr. Chair, Councillor Sato, thank you for holding this and also bringing forward a deferral. I'm happy, as Councillor Vicente said, to support that. I am one of those residents who live in a condo townhouse. I am actually staring at my green bins right now that are smushed up in my garage. But I know that many of my neighbors, including those others who live in townhouse complexes, are dealing with the issues that are of concern right now. I'm happy for us to talk to residents to find a solution. And quite frankly, if other jurisdiction solutions is not going to fit for Peel Region, then let's look at, through talking to the residents, piloting perhaps some new solutions and taking the lead on solving a problem. So I'm happy to support the deferral. And Councillor Sato, thank you for bringing this up.
Thank you. Councillor Mahoney.
Thank you, Mr. Chair, and I certainly am happy to support a deferral as well, just so we can get the information out there. It was my understanding through committee that some of these changes that are being proposed would be something that would be implemented in our next waste contract, so they're nothing that is kind of coming down now, and we'd be able to go out to public consultation and get input from those residents. I was pretty clear, as was Councillor Sato and Ras, and obviously others, on the property standard issues, on the storage issues, and those types of things. But it's my understanding, and maybe Norm could speak to this, but that these options are there to go out to public consultation to get input, so they could be put into the next waste contract. The current situation, if certain condo boards wanted the bins as they are now, they could under this if the condo board and the residents within that complex agree. But it's my understanding, and maybe you could clarify, Norm, that this is kind of an opportunity to go out to residents and see if this is something that would fit, and if it does or if it doesn't, would be implemented in the next waste contract, which I believe is 2022 or 2023. Norm, can you clarify?
Sure. And through the chair, the idea was to present these options to the different, the condos, the complexes. We'd be happy to go out and meet with the residents to talk about it, so that they could make choices of which option they wanted for their condo, or sorry, for their complex. And then the option number one, which is the one we were doing before with the larger green cart, if a complex chooses that, we could implement it fairly quickly because we have pricing in effect for that right now in our collection contract. If they wanted one of the other options, our recommendation is to implement it with the new collection contract, which right now is the current ones end in 2024. So it would be then. We've asked our current collection contractors for pricing to implement these early, and they both said that they would have to reconfigure their truck fleet if they had these different types of carts and bags in these complexes. And the prices, I mean, their initial pricing was kind of in the 3 million plus range per year to do this with the other options, which is pretty high. Of course, we'd negotiate with them if council wanted us to implement these options earlier, but obviously we'd get the best prices in a new collection contract when they wouldn't have to duplicate trucks and stuff like that. So so the idea was that we would go out and consult with the complexes on which choice they want for their complex, and then for the most part they would be included in the next collection contract.
Great. Okay, thanks, Norm. And I guess my point in that is that last time when we rolled this out, I think there was some challenges with the communication plan. There was a lot of residents who were upset about the way it was kind of done. So I think what the intention, again, and my understanding, was having some runway to be able to get out and discuss this with the residents without making any choices, because the new contract isn't up until 2024. The result of those consultations may be that residents still don't want the change necessarily, and we can do that. But Councillor Sato, I would certainly support the deferral, because I don't think this is a fire issue that we need to deal with right now, and perhaps a little bit more discussion with council to have an understanding as to where this is going. But again, it was always my understanding that it would be a full consultation process, getting input from residents, and again, it would be in effect for that next collection contract. And after consultation, it may come back and say that that the residents they want to stick to the current system that they have. It's not forcing it down their throats to say you need to take these bins, because I certainly would never support that. I think I was clear, as I think Councillor Santos said, and Vicente, and I know Ras and Sato as well, about the property standards. Condo corps have bylaws as well in place for their property standards, and that wasn't the intent. So happy to support. I think more information coming from the waste staff would probably be very beneficial to all council, so everybody can make an informed decision. Thank you, Mr. Chair.
Thank you. Councillor Raz.
Thank you, Mr. Chair, and thank you to Councillor Sato for holding this item. Unfortunately, I wasn't able to make the last waste meeting, but I think one thing we have learned is that because so many different townhomes were built at different times, there's different sizes and configurations, and some, what may work for some doesn't work for others. I have some older townhomes in my area, not one complaint. Others who, as you know, your staff have worked with me, we received a lot of pushback. So I think the communications is going to be very important in terms of moving forward, and knowing that it's not just the board of directors and property management. They may be our key contacts, but when it comes to a plan to survey those residents, we need to come up with a very fulsome communications strategy, and acknowledging that the different configurations, one size doesn't fit all. So I'm glad that this is going to be deferred to another day so we can have more detailed discussions on a rollout plan. So thank you very much.
Thank you. That exhausts my list. So, Councillor Sato, if you're satisfied, I've got a motion from you, seconded by Councillor Vicente, that item 6.1 on the WMSAC report dated January 2021, be deferred to the next WMSAC committee meeting. Is there anybody in objection to that?
Sorry, Mr. Chair. Yeah, I'm not sure it should go back to the committee meeting. I had asked that we have a separate meeting on this. Some of us have other ongoing appointments, which is why we're not on certain committees and may not be able to attend the committee meeting. Can we just leave it that we set a date for a meeting on this issue? I think it's a pretty darn key issue that we should try to have as many people available as possible to attend.
I'm here to help any way I can, but we do things either through committee or council, or I don't know if you're asking for a special meeting, maybe through to staff, if somebody can help me out as to, try to accommodate, but I'm just trying to understand what that entity would be. Would it have to come, and the clerk is whispering in my ear, would it have to be to come to a future council meeting? I don't hear anybody objecting, Madam Commissioner. Somebody's.
Could the clerk maybe give us the date for the next waste management meeting? Because it's never in my calendar because I'm not on the committee.
Sure.
Through you, Mr. Chair, I'd be happy to speak to it. It's Andrea.
Andrea, go ahead, please. Commissioner, go ahead.
Certainly. With all of the comments that we've heard here today, we would certainly be prepared, if it's the wish of council, to have it tabled formally at a future council meeting. We could certainly make the arrangements with the clerk. Alternatively, if you wish to take it back to committee, we're open to that option as well. Or we can even run a separate meeting if you wish, in terms of to informally update and share with you. However, I think the preference with what I'm hearing today is, there's an opportunity. I think there's an opportunity first to clarify what the proposal is. So what my recommendation at this point in time, just to make sure that we have a common understanding, if there are conflicts with members of council that cannot attend waste committee, I would certainly be open to having Norm come back in an appropriate date, and we could provide a presentation to council. But again, I'm open to your suggestions.
Just a thought, everybody. My concern is there's an old truism of running a meeting. You don't want to do your committee work at council, because then we get to 4 o'clock every day like we've been doing lately. The date, Councillor Sato, you've asked is April 1st, ironically, is the date of our next Waste Management Committee meeting. Councillor Sato, how would it be, because that gives you and everybody a little bit of lead time, why don't we see if that can be made to work as it should probably be at committee? If not, maybe next week you'll let us know that and others that it doesn't work, and we'll see if we can go to a plan.
I'm fine with referring it to the April 1st, Mr.
Good.
Chair.
Perfect.
And then if any members of council can't make it to that, but I would ask that, we're going to have that meeting, because I know sometimes those meetings are scheduled very tightly back to back with other committees. I think this is, it's a big discussion.
Yes, well put. Agreed. And so let's manage that accordingly. Well said. Thank you for that. So you've heard the motion to be moved to the WMSAC. We've given the date now, the April 1st meeting. And as I said, all you need is anybody opposed to that. It's otherwise carried. Very good. That carries. And Madam Clerk, over to you for a recorded vote for the remainder of item 11.2, the body of the committee report itself.
Thank you, Mr. Chair. I have the motion moved by Councillor Santos, seconded by Councillor Vicente, that the report of the Waste Management Strategic Advisory Committee meeting held on January 21st, 2021 be adopted as amended. Councillor Singh?
Yes.
Councillor Singh in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie? Mayor Crombie may be returning a little bit later. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Dillon? Councillor Dillon? Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, in favor.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Present.
Councillor Paleshi in favor.
In favor.
Thank you. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
In favor.
Councillor Raz in favor. Councillor Sato?
Present and in favor.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Thank you all. That's on to then item 12.1 under communications. Councillor Sinclair wanted the communication item from Scott Besco and Jerry Merkley, residents, town of Caledon, Ward 3, on behalf of the East Residents, Caledon East Residents Association held. And that was the petition received December 24, 2020, signed by 185 Caledon East residents in opposition to the Region of Peel environmental assessment change of the Old Church Road Airport Road intersection. Councillor Sinclair.
Yes, thank you, Chair. The petition regarded a option to take regional road, Old Church Road, which runs all the way from King Township right into Caledon East. And the idea was to then extend the road by buying a property, taking down a building, and running the road right into a residential neighborhood. And, the residents were obviously concerned, and regional staff now tell me that that option has disappeared and is no longer considered. So the item's here for just for information of the concern, and that's it for me. And I wish to move the petition. Thank you.
Thank you. My list, Councillor Innes.
Thank you, and just a thanks to staff. I know that the Airport Road EA has been a long process, and we're nearing completion. For the rest of my colleagues, it's a very large stretch of road that will greatly impact one of our larger urban centers in Caledon East. And a big shout out to our residents. So when all the options were originally presented, as Councillor Sinclair has indicated, there was an option of punching out the road, and the residents got engaged and created a petition, and we've worked to find alternative solutions. So thank you to the staff, and this will have a great impact not only on the village, but the revitalization of that community core and creating accessibility and upgrades to that village. So thanks to the staff for their work on this, and we look forward to completing this project, and the rest of my colleagues will see the completed EA coming for approval later on this year, which we're all very excited about and look forward to the work commencing starting next year throughout that village. Thank you.
Thank you. So that is moved by Councillor Sinclair, seconded by Councillor Innes, that the petition be received. Any objection to that? Seeing none, that is carried. That brings me all the way down to item 22, notice of motion 22.1, motion regarding appointments to the Region of Peel Planning and Growth Management Committee related to 18.1. Councillor Parrish.
Yes, thank you, Mr. Chair. I would like to move the 9 persons that have each been selected by their own councils. And I think the Vice Chair, Mayor Thompson, would like to second it. We would also like to request, and I think you have a motion, to schedule a March 18th meeting from 9:30 to 11:30 of the committee. There's a long gap between the meeting we've got next week and April 29th. And there is a regulation that you can't hold a meeting in the March break. So since there isn't a March break, we thought we would slip one in there. And we've checked with Adrian and he's fine with it, and the staff are fine with it. So if you have that motion, I would like to move that as well.
Thank you. The CAO is waving, so through to the CAO. Just to be clear, so to propose a meeting that now does not stand in our designated March break is what's, so it's 2 parts. The 9 people, the chair, vice chair, perfect, but then scheduling a meeting. Janice, I think something on, you'd like to speak to it. Please go ahead.
Yeah, well, just to let council know that today the province has literally just announced March break is going to be moved to mid-April. So the March 18th date then is not an issue for us because technically it's not the March break. Would that be correct, Catherine? No, you're looking at me funny.
It's not the March break, but we've already set the schedule. So I do think that we do need to have a vote to actually call it an extra meeting. Yeah.
Okay, so I don't know if we need to put through the clerk. The committee is the committee. That seems straightforward enough. And now, especially with the new information, I'm learning as well that there really isn't a March break. So it's a work day like any other, I guess. So Madam Clerk, can you bring us home and get all of that done?
Okay, perfect. Thank you, Mr. Chair. We'll start with the motion for the membership of the committee. I've got a motion moved by Councillor Parrish, seconded by Mayor Thompson, that the membership of the Region of Peel Planning and Growth Management Committee for the remainder of the council term or until their successors are appointed by Regional Council be as follows. Regional Chair Unica, Councillor Parrish, Chair of the committee, Mayor Thompson, Vice Chair of the committee, Regional Councillor Carlson, Regional Councillor Starr, Regional Councillor Innes, Local Councillor Kiernan of the Town of Caledon, Regional Councillor Medeiros, Regional Councillor Fortini, and I also believe Councillor Vicente has also been appointed through Brampton Council. And if are there any objections?
Before you, I saw, I'm sorry, Mayor Thompson, you were on my list. Did you wish to speak to that motion? You're just waving, you're good. He's good. The vote over to you, Madam Clerk.
Are there any objections? Hearing none, that carries. I've also got a 2/3 vote that will be required that the section 4.2.2C of the procedure bylaw 56/2019 as amended be waived to permit the scheduling of a planning and growth management committee meeting during the week of March break. And I can have that moved again by Councillor Parrish and seconded by Mayor Thompson. And that will require a recorded vote. So I'll begin with Councillor Singh.
Though I will, just because that's the fresh motion before us, did anybody want to speak to that motion? If not, the vote over to you.
Okay, thank you. Councillor Singh.
In favor.
Thank you. Councillor Singh in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie. Mayor Crombie. Councillor Demerla.
Yes.
Councillor Demerla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes, in favor.
Councillor Fortini in favor. Councillor Groves.
In favor.
Councillor Groves in favor. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac.
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden. Councillor McFadden. Councillor Medeiros.
In favor.
Councillor McFadden in favor. Thank you. Councillor Medeiros.
In favor.
Councillor Medeiros in favor. Councillor Paleshi.
In favor.
Councillor Paleshi in favor. Councillor Parrish.
Favor.
Councillor Parrish in favor. Councillor Raz.
In favor.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor. And that carries. We've got one more motion.
One more motion, go
One
ahead.
more motion. Got a motion before me that the meeting of the Planning and Growth Management Committee be scheduled for Thursday, March 18th, 2021 at 9:30 a.m. And need a mover for the motion. Councillor Parrish and Mayor Thompson, thank you. And are there any objections?
Seeing no
Seeing none,
objections,
that
that
carries.
carries?
Yes.
Very good. Thank you. Thank you all. That brings me to other business and councillor inquiries. Any other business or councillor inquiries? Please allow me on all our behalfs an early shout out to Mayor Hazel McCallion, who turns 100 on the weekend, and dare I say was in fine form at Mississauga City Council this week. Marvelous to see. And an early Kung Hei Fat Choi for tomorrow to all our friends celebrating the Chinese New Year, the year of the ox, of which I'm one. So there you go. Okay, moving on then, we are moving in camera. Councillor Starr, are you waving or did you? I can't hear you, Ron. I can't hear you, Ron. Go ahead.
Yeah, my hand's up. Is it?
Oh,
can you hear me?
actually, it is on your screen. It's not on my scroll. I apologize. Go ahead, Ron.
Oh, okay. I just want to say, since you mentioned the Hazel McCallion celebrations this weekend, there is a great video that's just being, I've seen a little bit of it today, and it's Hazel at 100. It's a 100-minute video of her life, and it's all being done in musical form by a lot of performers in the region of Peel, mainly Mississauga, and a lot of the names you'll recognize. You'll also recognize all those VIPs that are shouting out to her, all the way from the Prime Minister down to some little people. And if it's 7:30, it's 7:30. Just look up Hazel McCallion Celebration. It's on both on video and on YouTube. It's something to see. It started off as a 30-minute, then it was 40 minutes, then it was 60 minutes. So it's 100 minutes for 100 years. So it may be very, very interesting. It'll be a keeper. So I just want to bring that up.
Absolutely, Ron. Thank you for that. Okay, with that, Madam Clerk, and to the team here, I call upon you to move us formally into in camera, please.
Thank you, Mr. Chair. Got a motion moved by Councillor Starr and seconded by Councillor Raz that council proceed in camera to consider reports related to the following: 24.4, proposed property acquisition, Town of Caledon, Ward 4, a proposed or pending acquisition or disposition of land by the municipality or local board. Are there any objections? Seeing none, that carries. And we'll just give staff a few minutes just to confirm that we're in camera. Thank you.
Okay, so I've got a thumbs up that we are back properly in public following the in camera. The first thing I've got to deal with, though, is, and bad on me, the motion that gets us past 3:30. So I have a motion, Councillor Downey and Starr, that in accordance with the procedural bylaw 56/2019, section 4.2.12 be waived in order that the February 11, 2021 Regional Council meeting continue past 3:30. Is there anybody in objection to that? Seeing none, we will carry on. That carries. Thank you. The first motion that I have coming out of the in camera, moved by Councillor Grove, seconded by Mayor Thompson, that the donation of approximately 20 acres of land located at 13344 Humber Station Road, Town of Caledon, by Douglas Wilson and Catherine Ann Wilson to the Region of Peel, which was authorized in accordance with Resolution Number 2020-952, as approved by the Regional Council on November 12, 2020, be publicly recognized upon adoption. Madam Clerk, the vote over to you.
Thank you, Mr. Chair. Councillor Singh.
Favor.
Councillor Singh in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Yes.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Downey. Councillor Downey. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden. Councillor McFadden. Councillor Medeiros. Councillor Medeiros.
Yes.
Councillor McFadden, I believe I heard.
Sorry, I'm having a hard time unmuting. Yes.
Okay, thank you. Councillor
Yes.
McFadden in
Yes.
favor. Thank you. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor, thank you. Councillor Vicente in favor, and that carries. It's unanimous. Thank you.
Thank you. And with that, another matter that was arising out of the in-camera that we all agreed should quite appropriately be dealt with in public. Councillor Parrish.
I'd like to move that the Ombudsman of Ontario Guidelines, 4th edition, be subject of our next Policy and Procedures Committee so that we can be educated and, if possible, change, or if necessary, change some of our in-camera policies.
Second the motion.
It's been seconded. Yeah, thank you.
Ian.
Second. Well done. Any speakers to that? If not, Madam Clerk, the vote over to you. We can take it. So is there anybody opposed to that motion? Seeing none, that carries unanimously. Thank you. Madam Clerk, what else do you require of us? Okay. Moved by Councillor Rass, seconded by Councillor Downey, that the bylaw relating to the in-camera 24.2 being bylaw 12-2021 be given the required number of readings, taken as read, signed by the regional chair and the regional deputy clerk, and the corporate seal be affixed thereto. Anybody opposed? That is carried. Okay, these are the in-camera approvals moved by Councillor Thompson, seconded by Councillor Parrish, that the January 14, 2021 Regional Council closed session report be received, and further that the recommendations contained within the confidential reports listed as items 24.2 and 24.4 on the February 11, 2020 Regional Council agendas be approved and become public on adoption, and further that the recommendation contained with the confidential report related to 24.3 listed on the February 11, 2021 Regional Council agenda be approved and voted upon in accordance with Section 239, subsection 6B of the Municipal Act 2001 as amended be approved. All those in favor, Madam Clerk, just any objections? There any objections to that? Seeing none, that carries unanimously. Next, moved by Councillor Kovac, seconded by Councillor Mahoney, that the bylaw 13-2021 to confirm the proceedings of Regional Council at its meeting held February 11, 2021, and to authorize the execution of documents in accordance with the Regional Appeal bylaws relating thereto, be given the required number of readings, taken as read, signed by the regional chair and the deputy regional clerk, and the corporate seal be affixed thereto. You've heard the motion. Are there any objectors? Hearing none, that carries. And finally, moved by Councillor Grove, seconded by Councillor Fortini, that the February 11, 2021 Regional Council meeting be adjourned complete with an approved budget today as well. All those in favor? Any opposed? That carries. Thank you to all. Thank you to staff as well. We stand adjourned as moved by Councillor Parrish and Councillor Sinclair. Carried.